My dear viewers, here Dr. Sridevi with us. Very common complaint, the women have breast pain. Can you, Dr. Sridevi, tell us about breast pain in a woman?
Sure, thank you. So breast pain is called as mastalgia and it's very common. So we need to know whether it is a cyclical pain. So what do you mean by cyclical? Cyclical means whether it is related to the menstruation. That is whether it recurs every month. So if it is like that, it is because of hormonal change. So the hormone, whenever there is an hormonal imbalance or when there is an hormonal change, the pain comes. And after the hormones change, that is if the estrogen content reduces, the hormones get better, then again there is no pain. If sometimes it is not related to the cycle, that we call it as non-cyclical pain. Now when are the conditions? Because of hormones you can have pain. That is initially in puberty, that is when they first get their periods, there is a sudden imbalance in the hormones, so that time they can have mild pain. Then again in pregnancy, it may even be an early symptom of pregnancy also you will have pain, and throughout pregnancy also sometimes there may be breast pain. Again during menstruation, that is when you have the cycles, around that time you will have breast pain. And sometimes before menopause there is breast pain. And after menopause, this type of hormonal pain usually tends to reduce, it tends to settle. So that's about the breast pain cyclically. And sometimes what happens is, instead of the tissues, the breast gets replaced with fat. That's what you call as fibrocystic disease. So in that type of fibrocystic disease also you will have breast pain. You have to find out if the breast pain is one side or both sides. Usually because of these hormonal will be both sides. If it is one side, you have to ask them if they have any history of injury. They may have any history of trauma. So that kind of patients may have a single-sided breast pain. Along with this breast pain, we should also ask them for any associated symptoms. Because associated symptoms like lump or any discharge in the nipple, or whether it is radiating to somewhere else. Sometimes even pain in the chest, like for example, we call that as costochondritis in between the chest. So that also the patient perceives it as a breast pain. And cyclically, if the breast pain comes, we call it as fibroadenosis. So we have to exactly elicit proper complaints, like whether it comes every month. So you have to note down when does the pain come and when does the pain settle, in how many days. So if the pain settles, it's usually nothing to be worried about, and it is because of hormones it can settle. But always it is better to do a self-examination and find out. So these are some causes of cyclical pain and non-cyclical pain. And other than that, sometimes any infection of the breast. For example, even after pregnancy, that's during breastfeeding also they can have pain. So infection of the breast means we call that as mastitis. And sometimes what happens in breastfeeding mothers, when they don't feed, like for example, they continuously feed in one breast, or they don't express the milk, sometimes the milk gets accumulated. We call that as engorgement of the breast. So in those type of conditions also, they have very severe pain when it has to be expressed, they have to be taught to express it correctly. Because if that's not expressed, what can happen is it can form an abscess. So it can get accumulated, it can get infected, because an engorgement is easier to treat. But when it becomes an abscess, it has to be surgically, the pus has to be let out. So in the earlier stage itself, it has to be, it can be because the mother is not properly latching the baby. So we should know, if you have any symptom, there's nothing to be worried. Just consult your gynecologist, so they will be able to assess what type of problem and whether it is normal for you to have, or it may be because of an improper latch or improper attachment. So breastfeeding also, a lot of times they have a breast pain. And these breast pains, when associated with any other symptom, should be taken very carefully. It has to be, a self-examination should be done, and an investigation should be done. What are the types of investigations we can do is, one, self-examination, and also an examination by a gynecologist, and then investigation may be a mammogram, where they see in the breast if you have any other problem or it is normal. Because a breast cancer also can have, the main symptom may be a lump, but sometimes you may also have breast pain. So when it's like that, why this breast cancer is because it is a treatable cause. Some cancers we know in the late stage, whereas this cancer, if identified correctly and a treatment is done, there's nothing problem with your life. So because of that, this cancer is very, very important because it's a treatable condition. So accordingly, you have to do a mammogram, or sometimes they do an ultrasound of the breast to identify, and the breast pain has to be treated. So coming to the treatment, what can you do for breast pain is, if it is because of these engorgement, you have to try to identify the cause. And for breast pain as such, for the symptom, they can be given analgesics, and a hot or a cold fomentation can be given. Like for example, in engorgement, when you give a hot fomentation, that you can express the milk much easier. It will be less painful. So hot fomentation can be given. And for this condition which I told as fibroadenosis, which occurs every month, some people advise to give evening primrose oil, we call that comes in a form of tablet, so that can be given. And vitamin E, sometimes deficiency also is said to cause the breast pain, so vitamin E or multivitamins can be given. And after that, according to the cause, what is the cause or the symptom, it can be treated.
Yeah, this breast pain has told the premenstrual tension. Before menses they can have, sometimes supporting on the breast is needed.
Yeah, very important.
The breast support, firm support is to be needed. Unnecessary meddling is not needed, and the breast engorgement during after delivery, lactation, breast pump maybe sometimes can be used. And if it is inverted nipple, that can be taken care of, or cracked nipple, that has to be taken care of. Self-examination, as said, and mammography, this all helps to prevent the breast cancers later going into that. And I think it's a good information. Thank you, doctor.
Thank you.